It's time to purchase health insurance at Healthcare.gov. It's open enrollment, which runs November 1st through December 15th. This is for coverage that's effective January 1st, 2019 for the 2019 coverage year. As people are finding their way to Healthcare.gov for the first time, it's important you be aware of any imposters that might be out there. We're going to show you a couple examples of websites that are not the marketplace. You'll be able to recognize them. You'll be able to see what the real website looks like, so you feel much more comfortable purchasing insurance during open enrollment. Now, the marketplace was a creation of the Affordable Care Act. When health reform was passed, the marketplace was instituted as a place to help facilitate enrollment in insurance. If people were mandated to buy insurance for the first time, then there had to be a central location to do that. Some states do run their own marketplace, but if you visit Healthcare.gov, you will be redirected to whichever marketplace is appropriate for your state. So once again, November 1st through December 15th is your opportunity to visit Healthcare.gov. And we have an image of Healthcare.gov on the screen now. You can see the Healthcare.gov right across the top. It says open enrollment is here, and there are two green buttons across the center that say take the first steps to apply or log in to renew your coverage, and then there's 1-800 numbers and contact information across the bottom. This is the official Healthcare.gov website. Now, the image of the people or some of the background imagery might change from time to time. They might change their slogan to say time is running out as we get closer to December 15th, but remember, you're looking for Healthcare.gov as the link that you want to use, and you will see that right on the screen when you get there. There are other ways to apply for coverage. You can use the 1-800 number, you can send a paper application, and in the notes below we'll give you some instructions of how to do that. But Healthcare.gov is the site you can use as your landing page to find more of that information as well. So now let's take a look at a couple imposters that are out there and revisit why they are not the marketplace. Let's start with Healthcare.com. First of all, you can see it looks nothing like the official site. It's directing you to different insurance plans and agents where you might be able to purchase a private plan. This is not the marketplace, so don't be confused if you're looking for comprehensive coverage that follows the essential health benefits and makes you eligible for tax subsidies should you apply. This Healthcare.com is not the marketplace. What about Healthcare.net? We've had a couple people come through our office saying, well, I Googled health insurance and how to sign up, and I was redirected to Healthcare.net. And because the name sounds so similar, they think this is the marketplace. Well, again, with just first glance in the imagery, you can tell that it's not the official site. It also doesn't have a 1-800 number listed. It's a different 877 number. Healthcare.net is not the marketplace. What about Healthcare.org? Just on imagery alone, this looks very similar to the official site. It's not a 1-800 number. That's one clue. It's not the official site. We don't see any official logos or the word government.gov anywhere. And also, if you're reading the very fine print, which we have circled on the screen, you might have to really squint to see it. It says a privately owned website since 2009. Well, the Affordable Care Act wasn't signed into law until 2010, and marketplaces weren't a thing until 2013. So the fact that this has been around since 2009 is just another clue that Healthcare.org is not the marketplace. Finally, let's say you're just Googling around and you know it's time to sign up for Obamacare. So you type Obamacare into your browser and you get Obamacare.com. And it even looks kind of official because it's got the dark blue, which is some of the similar colors that Healthcare.gov uses. And it even says Marketplace Health Insurance on the bottom. Get a quote. This is not the marketplace. Don't be confused. The official language is Healthcare.gov. So let's just regroup. We've looked at a lot of instances of what was not the marketplace. Here's what you need to look at to be informed and to make sure that your rights are protected, that you're not being led astray into a site that is not official. You are looking for an official government seal, a logo, or the .gov that appears at the top. It's going to be very clear that you're on the right page. It'll be a 1-800 number and nothing else that is listed as your contact information. Take some time on Healthcare.gov to learn the basics. They have a glossary. They have frequently asked questions. They lay things out in different categories. It's a very comprehensive site. As you may have noticed with some of the examples that were not the marketplace, it wasn't as robust of a site. You were putting in your information to get a quote, and sometimes people would call you back. The marketplace rarely calls people. They certainly don't cold call people. So if you've gotten a robocall that says it's time to buy insurance, that is not the marketplace. But the marketplace itself will rarely call someone. every so often, if they need to help verify something, you will get a letter, you'll get a notice electronically, and maybe someone will follow up with a phone call. But generally, learn the basics as they appear on that website. They're going to lay out a lot of instructions for next steps. Compare insurance plans carefully. One of the things you'll notice as you're looking for health coverage for 2019 when you're shopping for insurance is you have the option to put plans side by side. That's a unique feature of Healthcare.gov, and it lets you look at plans, compare costs. You can sort by the type of plan you're looking for, by the type of premiums you might be responsible for. It's going to tell you your eligibility for financial assistance. It's very robust. That's another clue you're on the right spot, but it's also an opportunity to be an informed consumer. Know the marketplace open enrollment dates, November 1st through December 15th. Any other plan that says it's freely available outside of that window is not a marketplace plan, and most likely is not comprehensive insurance at all. Protect your private healthcare and financial information. Again, if somebody calls you or if a site says type in your social security number to get started, that is not the marketplace. That is not Healthcare.gov. Never give banking, credit card, or account numbers to someone that calls or comes to your home uninvited, and that's just good advice generally. But as you're working through the marketplace application, there will be instances where they might ask for dates of birth, social security numbers, other instances that might be important that you link you and your social security account to the marketplace or to the IRS in your tax returns. There will be private information that is required on Healthcare.gov, but if you don't feel comfortable or are not 100% sure you're at the right spot, you have the opportunity to ask for help. You can call the marketplace 1-800 number. You can find a local assister. You can ask for verification that they are who they say they are, and they will work with you to make sure that you feel comfortable providing the information that is required to sign up for health insurance and get tax subsidies or other financial assistance you might be eligible for. You should never be asked to pay for services for help with the marketplace. If you're seeing a local assister, or if you're going to a navigator, or if someone is helping you fill out a marketplace application, they will not charge you for that service. So that's another way to know that you're in the right spot. If you have problems with someone trying to charge you, that's an opportunity to call the marketplace and ask for assistance with that. Or certainly you can go to your state's attorney general and file a complaint, because that is not allowed. And finally, double check any information that is confusing. You don't ever want to click send or apply or submit on a form that you don't fully understand. That's an opportunity to call one of those numbers or follow up with one of those local assisters to make sure that you do feel comfortable and you understand what you're signing. These are binding insurance contracts that you are signing. You are agreeing to pay. You want to make sure you know your rights and responsibilities before that is finalized. Finally, we're going to provide that number one more time, that marketplace call number, for any questions you might have or for conversations you might encounter along the way where you might need a double check. So one more, what's not the marketplace? How about healthinsurance.com? They even have the two buttons across the center that say open enrollment is here. This is not the marketplace. We're looking for, one last time, we're looking for Healthcare.gov, nice blue imagery with green buttons, a 1-800 number at the bottom, and yes, that is the marketplace. If you have questions or want to send a comment, you can always send it our way at healthwatchwisconsin.org.